Hi friends, so today we're talking all things type 2 diabetes. So my name is Joyce and I'm a physician associate here in the UK, and I am privileged to work in general practice and I'm currently loving it. So if you're someone, a patient, prospective patient who would like to know more about type 2 diabetes, or if you want to know more because you want to support someone else, then you are in the right space. So what is type 2 diabetes? So basically, what that means is you're not responding properly to insulin. As a result, you end up with a lot of sugar in the form of glucose in your body, and that glucose is not processed properly. So simply put, that's what type 2 diabetes is. There are some risk factors associated with type 2 diabetes. So I'm going to go through the modifiable risk factors first, the ones that you can actually do something about. So one thing is you can go out and have more physical activity. You can go to the gym, you can go for walks, for runs, that kind of thing. That kind of thing will help with prevention of type 2 diabetes. Being overweight is another risk factor. Poor diet, which obviously goes hand in hand with being overweight. I am aware that there are other health conditions that might contribute to people being overweight, but overall, that is a modifiable risk factor. If you are someone who already has high blood pressure, you've got hypertension, that again opens up the risk for type 2 diabetes. Some medications, unfortunately, are also associated with type 2 diabetes. All right. So moving on to the things that you have no control over. So these are the non-modifiable risk factors. So your genetics. So for example, if your parents or your siblings have got type 2 diabetes, you are likely to have type 2 diabetes as well. If also people of color are likely to have type 2 diabetes, so that's ethnicity, race, and also being older, so being above 45 onwards, it just opens you up to a higher chance of having a diagnosis of type 2 diabetes. And also, if you are someone who has previously had gestational diabetes, again, that increases the risk of type 2 diabetes. So what are the signs and symptoms of type 2 diabetes? They are very similar to those with type 1, but I will go through those as well anyway. So you might likely notice that you are more tired than usual. So I know here in the UK, especially in the winter, we are just very tired people. But that would be basically your tiredness is more than what would be termed normal. You might also notice that you have blurry vision. Usually this is actually later on that pathway to type 2 diabetes. You might also notice excessive thirst. If you imagine you've got all this sugar in your body, which is not being processed as it should, then you're drinking water almost to dilute that sugar. If you think about it that way, it does make sense. You might also notice fruity breath in someone who has type 2 diabetes. You might also notice increased hunger. And also nausea and vomiting would be when basically this is a medical emergency. And then the other symptom would be increased urination. So if you're drinking loads to try and dilute that sugar in your body, you are then getting rid of more fluid through urine. So essentially that's how that all works. So what are the complications with type 2 diabetes? They're very similar to those with type 1 diabetes. So again, you are likely to have a stroke. You are likely to have issues with your teeth. You are likely to have heart conditions as a result, secondary to type 2 diabetes. You are likely to have complications with your kidneys, because remember, the kidneys play a big part in removing the toxins from your blood. So if you are having all that sugar, you can understand how that can affect that process that the kidneys need to implement in your body. You can also notice that it can affect your nervous system, loss of sensitivity and loss of feeling. So you can't feel anything. That's why people with diabetes are encouraged to have foot checks every year, because you can have an ulcer on your foot and you don't feel it. You have no idea it's there. And if it's left there, that can then lead to other complications. You can also have issues with your eyes. Again, this is something that would happen later on down the line, where you then have like we call it diabetes retinopathy. So diabetes does affect your eyes, and you can, if untreated, or if the diabetes is not controlled well, it can unfortunately lead to blindness as well. So what can you do with regards to type 2 diabetes? So it's not all doom and gloom. There are things that you can do, because type 2 diabetes is essentially a lifestyle disease. So you can improve your diet. You can't go wrong with vegetables, fruits, and nuts. You can definitely do more regular exercise if you are someone who is able to. I know some people have conditions where they cannot do, physical activities, but if you can, that would definitely help with prevention of type 2 diabetes, because it can be prevented. You can also end up needing treatment for type 2 diabetes. So the one that you would be started on here in the UK would be most likely metformin. The reason that you would start with metformin is also the fact that it does, to a certain extent, help with weight control. But very much, type 2 diabetes, like I said earlier, is a lifestyle disease, and you can, with good exercise and diet, you can reverse it. So if you're someone who has been to the GP and you've had your blood test done, and you've been told that you are pre-diabetic, there are things that you can do here in the UK, depending on where you live. We do have referrals that we can make for you from the general practice, so that you can go on a prevention program for type 2 diabetes. I would strongly advise going through that, because it will help encourage you to use lifestyle to help with control, or rather prevention, of type 2 diabetes. I know people who have had tremendous results from such programs, so I would definitely advise those. So this is me done for today. I do hope this has been informative, and if you have any questions, then put them down below. I will aim to respond to those. But ultimately, please, if you like this content, then share it with someone who would benefit from it. If you are someone who is into just advocating for your own health and being knowledgeable about your health, then please, subscribe to this channel, like it, and share. Thank you so much for joining me today. So I will see you next time. Take care.